Hello guys, today let's discuss about the diagnosis of PCOS or PMOS in adults. It is very important to understand that the diagnostic criteria for adults and adolescents are different, and we have the Rotterdam criteria, which is for the adults, and in that first I shall be highlighting about the ultrasound criteria, that is the Pcos or the polycystic ovarian morphology. Now, this is one of the three parameters given by the Rotterdam for diagnosis of PCOS. So, in the ultrasound, it is important to remember some of the key points. First is that they advise us to use transvaginal ultrasound than transabdominal ultrasound. So, TVS is better than TAS. Also, they have told that you should use a TVS transducer with a frequency bandwidth which includes 8 megahertz. Okay, so this is the standard frequency that they have given. In that, the threshold for Pcos should be that in either of the ovary, that means at least in one ovary, the total number of follicles should be more than equal to 20. Now, this is very important to remember. Earlier in Rotterdam criteria, the number of follicles was given as more than equal to 12. But this has been revised by the ESHRI and ASRM guidelines, and now the total number of follicles per ovary, that is FNPO, is more than equal to 20. Also, we also have another way of diagnosis, that is ovarian volume, that is any one of the ovaries having a volume of more than equal to 10 ml. Also remember that when measuring this ovarian volume, you should ensure that there is no corpus luteum cyst or dominant follicle present. In case you are not able to visualize the entire ovary, or you are using an older technology ultrasound, they say that you can also take the follicle number per section of the ovary, and that cutoff is more than equal to 10. The other two criteria of Rotterdam are oligo or anovulation, that means the oligomenoric or anovulatory cycles, and clinical or biochemical hyperandrogenism. In clinical hyperandrogenism, she can present with acne, hirsutism, or very rarely even male pattern of baldness. In biochemical, you have to test for her free androgen index, or you can also see that the testosterone level which will be raised. So this is the three Rotterdam. These are the three Rotterdam criteria, and presence of any two of the three are diagnostic for PCOS or PMOS. I have already made a video regarding the different phenotypes, which is important.